Spokane couple got a surprise medical bill in the mail they thought their insurance had already covered, especially since the hospital they picked was in their coverage network. What they didn't know is that an ER nurse at Sacred Heart worked for a separate company, not included in their insurance network. Turns out their story is not unique. Patients all over the country are getting surprise bills. New on Nightside, Kyle Simchuk explains how lawmakers are now trying to protect them. Kyle, a new bill would force insurance companies and doctors to settle the difference themselves.
Well, instead of passing that cost off to patients, a Providence spokesperson told us they don't believe patients should be caught in the middle of these billing issues. But this young couple now has to come up with close to $1,000.
After his wife hit her head snowboarding, Herman Meyer knew she needed to get checked out. He also knew that Providence Sacred Heart was in his health insurance network.
They ordered a CAT scan right away just to make sure everything was good with her head. It came back all positive. You know, the doctor came in just to kind of consult with her.
With that peace of mind came a bill that Meyer was expecting.
The first bill came from Providence, and so that listed all the different things like the CAT scan and all those different things like the small medications that they gave her.
His copay was $175. United Healthcare covered the rest.
Covered $2,662. I thought I was done. I thought I had paid what I was expected to pay for Sacred Heart, for their services.
But Meyer was in for a surprise this week when he opened his mail.
We got something in the mail from Spokane Emergency Physicians, and I had no idea what that was.
It turned out to be a second bill. The registered nurse who examined Meyer's wife worked for a different company that wasn't a part of their insurance network.
So that total bill was $1,400, and insurance covered $604 of it. So we're still left with $802. They would have had a million chances to tell us what the situation was as far as providers and network care and all that stuff, and that was never made apparent to us while we were there.
These surprise bills are happening to patients all over the country. Lawmakers in the Washington State House just passed a bipartisan bill to take patients out of the billing disputes, forcing hospitals and insurance companies to negotiate.
The different providers aren't being transparent, and I think that's really detrimental to like a lot of families, no matter your financial situation. That we're lucky enough that we can handle it, but there are a lot of families out there who an $800 bill would cripple them.
And in a statement, Providence tells KXLY they are aware of the issues affecting patients that may arise when they are treated at an in-network hospital by an out-of-network provider. We are working with federal policymakers to support bipartisan solutions and are currently evaluating the various policy proposals. We agree that consumers should not be caught in the middle of billing issues between insurers and providers. Now, that bill still needs to pass in the state Senate before it gets to Governor Inslee's desk. Aaron.
Kyle, thank you.